Okay, so this is our first podcast that we're sending out today, and we've been amazingly privileged with the company of our local mayor, and she is going to enlighten you all on why she does what she does and why we do what we do. Enjoy. Are we all good to go?
Don't move, yeah.
We are ready to go, yes. Where should we start?
What's your name? So everybody knows who you are.
Yeah, well, good morning. I'm Lesley Millard, and I'm recently elected Mayor and Chair of Town Council of Burnham and Highbridge.
Woohoo!
Woohoo!
How do you get to be a mayor?
Well, it's all been a great learning curve because I've been a Liberal all my life. My father was a Liberal councillor, but I've never been actively political. And so recently in March, the Lib Dems approached me and asked if I'd stand. And I thought, that's fine, I won't get in, I'll just go for it. But I did. And then they asked me if I'd be the Mayor and Chair of Town Council. Now, we have a very new Town Council with a lot of new councillors who have no experience of being a councillor before. So I was just one of many. But because of my background in education, I've done quite a lot of adult education as well. So I'm used to speaking and running meetings. And so I was the one with the experience to lead the chair of the Town Council. So I went for it and I said, yes, I'll do that. And actually, I'm loving it.
So because you're Chair of Town Council, does that automatically make you Mayor?
Not always, but in this case, yes. In other town councils, they've separated the job.
Right, okay.
But here, they've kept it together.
Okay.
So, yes. So it's Mayor and Chair. And
Mayor and
Mayor and
Chair.
Mayor and
It's a nice little phrase.
Wonderful.
That
Yeah,
is.
yeah,
I'm sure we could make a rap to that.
Well, you might be able to.
Do you get lots of training and things on how to be a mayor?
No. There is training, and we've all registered for training. But of course it's never when you want it.
No, of course.
We need it now, but of course it's further down the line than we'd like it to be. So we're just working very closely together, supporting each other and making sure, I mean, from a mayor's point of view, it's really much more about liking people. And I have always liked people. And I really find it fascinating meeting so many. And I think it's good to have mayor and chair together because the mayor's role is getting out and meeting people. And by meeting people and listening, and that's the very important part, the listening part, you gain a much better picture of what is happening in the town, and it then informs my decisions when I'm a councillor on the council. Okay. Because I've only lived here coming up for 6 years now. Didn't know Highbridge very well at all, but happily I'm going to be moving into Highbridge, which will be lovely. So I've done a lot of listening over this last month. It's been very important to me to get out, and not just where I've been invited. I've invited myself to places.
Of course,
as well.
yes.
So I've got 3 priorities which are very close to my heart. One of which is mental health.
Okay.
The second is climate change and the ecological emergency. And the third one is giving youth a voice.
Okay, fantastic.
So I've been quite proactive over this last month, getting out and meeting people who I feel will help further that agenda.
And there's quite strong links there, isn't it, with mental health and giving young people a voice, because certainly what's something that we've noticed in the charity, but also in the community itself, is that whilst they have a voice and they voice their challenges or whatever they want or their joys, but does anything ever come from that voice? And I think sometimes it is allowing that to happen.
It's providing the opportunity for them to have an impact on decisions that are being made. So you can have a voice and voice your opinions, but if we channel it in the right direction, it can actually impact on decisions that are made in the town.
But is it for us to channel that, or is it to ask them how they want it channeled?
Absolutely. I mean, that's what the Youth Town Council is going to be all about, and what I want to do. And I met with the head of King Alfred's, and he's really keen to be involved in this, is to start from the process of gathering a youth group together and saying, right, what do you see as the role of a Youth Town Council? how do you feel it should impact on what is happening around you, and how can we now do that and facilitate that process, is what I see my role as. And the head is very, very keen to be involved. I want to involve all the youth groups in the town. So we've got Sea Cadets, we've got Air Cadets, we've got some really active youth clubs happening as well, and lots of other groups that youth attend. And I just want to draw them in and say, you'll have greater impact if you share your voices together.
But I suppose renowned young people struggle with that. But also there's quite a lot of young people that are educated outside of Burnham and Highbridge.
Yeah, and that's where I'm hoping involving any youth group in the town will draw those people in.
Hopefully you'll capture as many people. Many moons ago, I was actually involved in Burnham and Highbridge Youth Town Council. Only for a very short period of time. I think it was about 6 months. The Youth Town Council actually had, I think they'd all fallen out. I think because although they were putting ideas forward, nothing was changing. And I've actually been involved in quite a number of things where you're sort of a youth or a junior role to a board or trustees or whatever, and that has always been the biggest problem. Is you can voice an opinion, you can voice your ideas, but it's actually getting any kind of traction. And of course, one of the big things that I learned was that everything takes a long time. It's not going to happen overnight.
Yes.
I'm involved with where I live, the sort of community group there. It's a bit like a parish council, but it's not. And it is taking us, I've been involved now for nearly 10 years, and we are still struggling to get things to change that we talked about 8-9 years ago. And it's ensuring people understand that things take time. And I think that would be my advice, is make sure that the youth groups that get involved, they know that actually things aren't going to happen overnight, but we really do want your
And the
input.
problem is you lose some of that group in natural progression.
Yes.
So that you can build in sustainability in that, you get further elections, but you will, it's like any democracy.
Yeah, of course.
That you elect somebody and then they move on and then you elect somebody else. And so it's very difficult to maintain momentum of decision making. And I think that's where we need to look at how we set it up to gain as much and to keep as much of the experience and life of that town council. So I think it's how we set it up is going to be key.
Definitely.
But I also agree, but you see, it's not just youth have that problem.
No, and I think that's the bit that
we
I've
all have
learned.
that problem in democracy.
Yes.
That, it is a democracy, we can say what we like, but actually, if you think back to the last few years, Liberal Democrats had a voice, but it wasn't a strong enough voice in the town council to make changes.
Yeah.
So we've all had that learning to do, to say, okay, we can really put our views forward and support certain things, but sometimes you're not going to get what you want, because that's the way democracy works.
But is there another side that, you know me, I've always got the other side.
No, that's good.
So, I obviously run my own company, like Mike does, so we're very much about decision making. So we're very open within our teams that actually you want something to change, bring a good case forward and we'll do our best to change it. And we don't wait 3 years, 5 years, 2 years or a year. It's done, it's instigated. And it's the dynamics, isn't it, of change. It's like, why does it have to be so difficult?
People find change really hard.
I hear that, but if you've all agreed that that's a really good idea,
oh yes, then it should happen.
Why can't it just happen?
Yeah,
I think a lot of times as well, it comes down to actually, people like to voice an opinion. Again, we have a similar thing where I live, where everybody that lives there wants lots of events. They want this, they want that, and then you ask, well, who's going to volunteer to help move it forward?
That's the difference.
And that's always the problem. Is you get 100 hands that say they want it. And how many hands do you get to say, I'm going to lead that and run that? And you'll be lucky to get 1 or 2.
And don't you find in communities like ours, it's always the same people you meet?
It
in
is.
Every decision-making body.
Yes.
That because if you want something done, you ask a busy person.
Exactly, that's it. And then unfortunately, if you're busy, You know, you don't have the time
it's
to...
human nature, isn't it? It's something that I've had to accept all through my professional life as an educator. You know, we had PTAs and we had, you know, that worked with the school, and some years they'd be absolutely fantastic and everything would be done, and other years it wouldn't be quite so effective. And I think you learn to accept that, do what you can to empower, but accept that some years it's not going to be wonderful.
Yeah.
And I think getting as old as I have, I've learnt to accept that. But also, I'm a fairly stubborn sort of person, and if I see something as being really important, I will keep going.
Yeah.
And keep going and find a way. And if a block comes in the way, then I'll go round. I'll find a way around it. And I think that's resilience. And saying, yeah, this is, I truly believe this should be happening, and therefore I've got to find a way of making sure that happens. And you, as you quite rightly say, it takes time.
It does. It really does.
Is it resilience or responsibility?
Well.
Because where do we, and you know, you're saying, oh, we all want to do this, and everybody's going forward with that. But there's that point where, well, you can put your voice to it, but what else are you going to do to it? And I suppose, particularly as a mayor and a town councillor and politician or whatever, you've got that bit about responsibility. So where do we individually have responsibility in anything?
I mean, all you can do, I think we've all been impacted by COVID, and I know that's a very good excuse these days. Everything, oh no, it's because of COVID. There's lots of good things that have come out of COVID, and one of those, I think, is that people have realised they need each other. But what has been impacted, I think, is that also people have become insular, and they said, I'm all right in my little bit, and I don't want to do anything else in case it puts me in danger. And I think what we've got to do is try and get over that now and encourage people out. And I think it's about identifying strengths and using people's strengths, so that within the team, you know, so-and-so is really good at engaging with people, somebody else is really good at the finances. And it's identifying that as a team and saying, right, this would be really good for you to, you know, and moving together in that way and valuing contributions. Because you can put people off by them saying what they think, and then, as you quite rightly say, it's stopped, and that's fine, thank you, but we're doing this. And I think it's that recognition, saying that's a really good point. Hold that for a moment. We will be coming back to it. At this moment, we're focused here. And I think it's people feeling valued are more likely to give in a community.
Well, I suppose for us as a charity, one of the things that we have felt at times is very undervalued about what we've done and the impact that we have. And I know we don't scream and shout about what we do as a charity a lot, because it's about respecting people's confidentiality. But when you're seeing like up to 135 people per week within the charity, that's massive. You know, the fact that we have one of the most successful rehabs in the country, in our town, is phenomenal. Do you understand? The fact that we launched an IT system, which is now national, that goes to all the rehabs in the country, is phenomenal, which is what Mike wrote. You know, all of that. But do we ever actually celebrate that? And I think that's the bit. I mean, it's very tough, because people want to, like you say, want to move on, but actually celebrate what you have got before you move on into something else.
Absolutely. And what I'd like to see as my role with you as my charity is to help you celebrate and to really raise awareness of all the work that you're doing, and find moments that we can say, right, that's a moment when we can really do something to really, because I do respect people's confidentiality. Yeah. So the publicity machine doesn't always work for that. Yeah. So we've got to find some other way of doing that.
I think you're absolutely right, and we're really grateful that you've chosen us as your charity of the area. And actually, it's really exciting, because actually it means that we've got someone that is high profile in our local area who can help promote us. And you know, as Angie touched on, some of our stats for the last 12 months are phenomenal compared with other organisations in the local area. You know, I used to do some work with the local Citizens Advice Bureau, and they weren't seeing that number of clients per week. However, everybody knows the CAB, and you know, the local authorities and local funders, they pump so much money into those kinds of organisations, And I think we're really amazed ourselves at how we run this charity on a bit of a bootstrap, and we deliver so much value to people in the local community.
Absolutely, and it's so invaluable. And I think what we've got to do is work together to look at ways of really showing people that and getting it out there. The stats that you've just been saying are really important, and people don't understand.
No.
I will say that there is a confusion between Somewhere House and Somewhere House Somerset.
It's a pain in the arse, really, and we've been trying to get our heads around it, because ideally, how it came about was that when the charity was founded, the people who supported me in setting up the charity said, no, we want them to have this similar to what we give, the kind of counselling that we give in the rehab in the charity. And I said, I hear that. And I said, so what do you want to call it? And that was how it came about. And it was a real, and it was nothing to do with me, and I would rather it hadn't have happened, but it is what it is, and we've kind of accepted that it is what it is now. And I always say Somewhere House Somerset, the one with the pink house, not the green, not the green leaves or whatever it is. But I hear what you said. But coming back to that, and not necessarily this being about the charity or the rehab or the IT organisation, but that bit about, where does the decision makers, where does the community come together and go, right, this is what we're going to work on. Yeah. I mean, when in COVID, we got loads of money for the charity, loads of money.
And
in COVID,
interesting.
Yeah, in COVID.
Yeah. And
but now it's not.
It's tailed right off. And the number of people that we were seeing before COVID, I think was around about 70 people a week.
76.
Yeah, so it's a tremendous increase, and it's not died off because COVID has sort of tailed off. So the number we're seeing
mental health is long lasting, isn't it? It's something that
it is very long lasting. I think that's what we also pride ourselves in, is that we will see people not for 3 sessions and that's it, you're done. We'll see them for as long as they need. And if we need to see somebody for 6 months, we'll see somebody for 6 months. If they just need to see us a few times, then we can also do that.
Does that then also come back to the bit about the local community? Is if we felt like this, how are other communities, how are other organisations in the community feeling? Because I can, all this money was chucked at people because of COVID, like you said, but the truth about it is that's a false kind of...
It is. I had a really interesting conversation with one of the local authorities yesterday regarding Ukrainian refugees. We're seeing a massive influx in the local area because what the local authority is seeing is a lot of the people that are offering their homes as part of the Homes for Ukraine scheme is they are generally people that are quite affluent in country houses. And they're liking it to back in the war into World War II, where young people get on a train and go off into the country, and they're seeing similar kind of things, and that's fantastic. And what people are doing is fantastic. However, what that means is the refugees that are coming over are then not being part of the community because they're in a country home, isolated. They don't know how to access support. And the demand and need for some kind of therapy, some kind of counselling, or just someone to talk to, actually, that is growing rapidly. Yeah. And I think we're going to start seeing referrals from some of the statutory agencies and bodies very, very soon, if we haven't already. But again, there's no money available for that.
I think the sad thing is it's like a lot of response. It's not a strategic response. It's crisis management. Yes. Let's put a plaster over this. We'll get them into homes. It's fine. No. Think about this. They need to be in a community where they can integrate and where they can be supported within the community. And I agree with what's happening there. And I think it's this lack of forethought. Yeah, we need to respond. This is it, but it's crisis. No. Let's just wait a minute. Yes, we will respond, but let's think about how.
Yeah.
And I think that looking behind it all and saying, how can we really build in a good, strong foundation for these people, that this is going to survive. It's not just going to be a plaster that will come off in the bath. We've got to, otherwise we're creating more problems for the community.
We are, and unfortunately some of the things that we are starting to see is that some of the very kind volunteers that have offered their homes to some of the refugees, it's now been going on for 6-8 weeks. We don't know how long this could go on for, which is incredibly sad. And some of those relationships are now starting to fracture. So now what happens? Because if you've got somebody that's in your home and you've got a fractious relationship, then what happens? And sometimes they need some kind of counselling or some help, guidance, even signposting, to be able to go, let's try and repair this relationship before that becomes a crisis point.
Isn't this what happened though? Well, I remember very early on in my practice, probably about 20 years ago, it could have been more than that, they decided to integrate mental health within the community. So what they wanted to do was close down all the big hospitals and bring people into the community and have smaller, almost like cottage hospitals. They're not, but smaller hospitals for people with acute needs for mental health. And so they were integrating both social care, housing, mental health services, all of those people, children and families, etc. And I used to sit in meetings and in the community mental health team, and we'd sit there and we'd all work together collaboratively to get people's help. And instead of them all these people having to go round and round to every organisation or service, it was all under one roof. And in a sense, that's they've closed all these beautiful big hospitals. The large proportion of people who actually needed those hospitals or needed that kind of support no longer have it. They were thrown into the community, and the community were like, oh my God, what are we going to do? We've got no idea how to support people in the community who are perhaps struggling with their mental health, and they're stood on the street corner waving at everybody or whatever they do to kind of cope. And we're back there again.
We are, and I think we're as a charity at Summer House Somerset, we are trying our very best to help as many people as possible. We've had our referral book closed now for I think coming up to 2 months, and I think we've still got something like 35 people on that waiting list, and we're getting messages through our social media channels saying, when are you going to reopen? And the reality is that we just can't see any more people at the moment. We're full, and that's not without trying as well. We're recruiting for more counsellors. Some of the counsellors that we've recruited recently, we're still waiting for things like their police checks to come back, their references. Everything is still from that knock-on of COVID is slow. But we're desperate to recruit more counsellors into the charity so that we can see more people. And we've always said that the charity will go on for as long as we have funding coming in. And if we end up spending all of the money that we've got in the bank in the next 12 months, then unfortunately we will have to close in 12 months' time. But we just want to support as many people as possible.
Does that integrate though with that Ukrainian thing? Do you know what I'm saying? It's just different examples, isn't it, of how communities kind of need to learn to take more responsibility for actually what's happening in their community. I mean, the RNLI are in the same boat, the lifeboat, do you know what I mean? All of them, everybody's in the same position, aren't they? And how do we bring that together in a way that's a community?
The problem is that we've got this issue within local government where because of democracy, it changes over a period of time, so it's very hard to hold continuity.
Yes.
National government has had a huge impact financially on local government, so we've lost a youth service. That has huge impact, and I'm convinced that's part of why you are having to meet the needs of so many young people, because they've no support out there. What are we doing here? I was talking to Ken Hindle, I think it is, who is 88, bless him, and he's been in Burnham for many years and used to run the youth groups around, and he was part of the youth service, and he was saying when the youth service went, he actually personally supported somebody through very, very serious mental health issues, and you start to look out and say, well, how can we provide this support? And unfortunately, as you're quite rightly saying, it's down to money.
It is, yes, yeah.
And should that come from government, or should it come from the community? I mean, should the community be supporting more than they do? I think it's really hard.
You kindly came to our annual general meeting the other week, and as you saw from some of the statistics that actually, referrals, we're getting a lot of referrals from statutory organisations, from doctors, GPs, from
mental health services.
Exactly, that's it. Because even they're struggling. And
are they struggling, or is it that their criteria has changed as such, or those? I'm just not saying we as a charity, but I'm saying voluntary agencies, because I know we're not the only people that are in this position, but it's easier to go and see Mike.
And it sort of wipes them off the list.
Yeah,
and it comes back to statistics. We're talking about our statistic, or for their statistics, if they've signposted 25% of their clients, it's kind of off their bottom line. They look good, and so on. Is that the right approach that we should be taking? Absolutely not.
No, of course not. And I mean, from a personal point of view, I've obviously been on the receiving end or trying to look for help for a member of the family. And very, very serious mental health issues. We were working with the crisis team in Weston. And when the crisis team said, okay, things are getting a bit easier, right? We'll put you in a year. We were given the waiting list is a year.
Bloody hell. That is shocking.
You just think...
And that's a crisis point.
And that's crisis.
But that comes down to management? Because, fundamentally, and I know when I worked in the NHS, and I worked there for 15 years solidly, I loved my work, absolutely loved it. A lot of the challenges is you've got like 10 middle managers who are being paid amount of money. They're not practitioners, they're not seeing anybody. So in fact, do you need one manager and all of that money to go down into actually practicing to see people who actually need this help? I don't know.
I think the NHS in general needs a total overhaul, because we're seeing locally that we can't see a doctor. A friend of mine who's terminally ill needed medication, and the receptionist said, well, come at 8:30 in the morning and stand outside.
Yeah.
Pardon?
Yeah.
Really?
But I think also that comes about sharing experience. So my local doctor are fantastic.
Yes.
Throughout COVID, the whole thing, I cannot fault them at all. They see people when they require, they call them back, and their numbers have gone up massively because we've had so much housing around here. So it's not like anything's, a lot's changed for them, but they've still managed, and they've done an amazing job. But we also work with the people that you're talking about, and it's like, why don't you take the learning from another surgery?
Absolutely.
And utilise that, and then you've got a model that works, instead of we know best. You obviously don't know best.
No. I mean, I've been talking to a lot of people about this, and one of the comments was that, and this is purely hearsay, I have no evidence, so it is that during COVID, the medical centres got used to not having to see people, and they found it actually quite a comfortable way of working, and that, telephone and maybe video, and I mean, I was in a position where I had to take a photograph of something to send into the doctor. And it's being said that they don't want to go back to the first-hand, face-to-face.
But I don't think there's anything wrong with that system, the triage system, because I don't know if you saw that article that they wrote about the triage system that one of the hospitals had set up north for A&E. And what they found was, by people just turning up for A&E with like a sore throat or a poorly ear, or my child's got a bit of a temperature, and actually all they needed was a paracetamol, ibuprofen, or whatever the circumstances were. And they actually found they literally had a bit at the front where there was a doctor or a nurse, a nurse practitioner, and sat there and said, you can do this, you can do that, you don't need to be there. And the waiting list at this hospital came down dramatically. And in a sense, I think that's what they've been trying to do at the surgeries, which is triage people over the phone And I think there's a really good way, but there's a
Absolutely.
time and a place.
But people do sometimes need to be seen.
Of course they do, but then you see them, and that's like my GP surgery, are doing triage on the phone, and then they see you.
Yeah, well, you see, it doesn't happen,
And I
unfortunately,
think that's
locally.
the problem is they're all so different. So my local surgery, they have an online system, but it's only open for when they have people available to respond. So I think it opens at something like 8 o'clock in the morning, and if you try and log on to their website to make a request at 8:15, their system's closed because they haven't got the staff to handle it. But then what I discovered is if you go and look on their website, it tells you what hours their GPs and their nurse practitioners and their other nurses and whoever else are available. Well, they all worked. They sort of avoided the 8 a.m. slot. So I'm thinking, so when are they actually working? When do they actually see patients? Because if you've got this system that's only open between sort of 8 and until it's full, but all your GPs work at like 6:30 in the morning till 8 o'clock, when are they actually seeing people? It's a really bizarre system, and I think, in this country, we have this concept whereby GPs own their practices and they run them and they have sort of the autonomy to kind of do what they want. But actually, as we're sitting here, the three of us live in slightly different towns, slightly different villages, and we're seeing very different systems. Why isn't there one central system and we all work the same way?
There is, though. There's a central system, which is the CQC, which inspect these places. There's a very clear criteria that all of these organisations, hospitals, doctors, dentists, care homes, whatever, have to follow. And in there, there's a very clear, this criteria states what they are supposed to provide. And I think, sadly, we don't get, the accountability isn't necessarily as strong as it could be, but also, and this is a bit controversial, do we not as patients have an accountability? I mean, how many times do people go to the doctor, they've woken up in the morning with a sore throat? Well, we have a 3-day rule in our house. If you're still sick in 3 days' time, you go to the doctors, unless you are absolutely unable to walk or it's obvious that you are something seriously wrong with you.
Yes,
we have a 3-day rule. That 3-day rule sits, and actually I can't remember the last time I went to the doctors in that sense, because we are self-reliant. And I think, does that then come back to what you were saying about government? Fundamentally, when do we as grown-ups take responsibility for our actions and the actions of what we do in the community and what we don't do, etc.?
I think you're absolutely right, and I think that's where having these online systems whereby it almost asks those questions. I remember a few years ago, probably 5 years ago, NHS Online, they had almost like an online health quiz where it would ask you a sort of variety of questions, and it would say what you should do, whether it was to speak to your GP, whether it was to go to a pharmacist, and whether it was to go to A&E. And that worked really well, and for some reason I don't think that exists anymore.
Surprise, surprise.
Surprise, surprise. But going back to what I was saying about my local surgery's GP practice's online website, the other problem is because it's only open between 8 a.m. and when they're full, if you've got people that work nights, or you've got people that start work at 6 o'clock in the morning and can't be on their phone for 8 o'clock, all that's doing is compounding the issues at your local A&E, because people that have got an ear infection for the last 7 days, they can't speak to their GP because their system is not available. So what are they going to do? They probably will go to A&E because that's the automatic
But also, we've got to recognise there's a large percentage, particularly in Burnham and Highbridge, of people who don't have a computer.
Yes, there is that as well.
Now, how are you reaching those people?
You don't.
Yeah.
But also, I mean, in London, they have 24-hour GP services.
Yeah.
They always have a GP available, so you can go in at random times, and you can just, even if you're not registered, you can just pop in and you can see a GP, and so they work really well. But we live in a small community, and we don't have that.
And I think that's it. And even if there was one, let's say there was one in Taunton or Weston, you then have the issue of transport and all of those kind of things.
Yes, exactly. And transport's come up as a major thing through my canvassing before the election, but also through my work with my community cafes and hubs at Burnham-On-Sea. There are a lot of elderly folk who no longer have access to a car. And one of my friends at the hub, she had to go to Musgrove Park Hospital for day surgery. and she said to me, I don't know what I'm going to do because I've tried Slinky Bus and they've quoted something like £75 there and back.
Wow.
And you think, what? So I took her and I waited and I went and got her afterwards. But at the end of the day, what are we doing here? Why we're not meeting the needs of these people? Something is very wrong.
Yeah.
I mean, you look at a hospital transport. I'm on a working group at the moment through Good Neighbours, and we're looking at transport for vulnerable people, particularly Burnham-On-Sea, but it obviously overflows into Burnham and Highbridge. And we had 12 taxi firms. They're now down to 5. And we tried for a week to contact those taxi firms, and only 2 answered the phone.
Wow.
And nobody works after 5.
Which is what we found in the rehab. We could never get anybody to...
And you think, what?
Yeah.
So that's one element you can't use. So we are looking at, within Good Neighbours at Burnham-On-Sea, looking at providing
But there used to be
community
a scheme,
transport.
didn't there? Because there used to be a scheme where, God, I'm showing my age here. I really don't want to be showing my age. Where there was groups of people who offered to drive people around, and all you had to do was provide their petrol.
It has to be set up.
Yeah.
That's what
But
one
we
of the
had that
elements we're
locally.
looking at.
We had that locally. It was really strong. It was brilliant. Absolutely really strong team. And I don't know what's happened to that. But also they've got the buses that you could like round. I mean, I can't if I can't drive or don't have a car, I can't get anywhere unless I walk along a 60-mile-an-hour road
Yes.
on my own, which trust me is not safe. I can't get anywhere at all.
No.
I'm 3 miles away from any facilities at all.
Yeah. Well, the Slinky Bus is great. It's provided by Somerset, and if you register with them, they'll pick you up from where you are and take you to where you want to be. But those big, I mean, within Burnham and Highbridge, it's sort of £2. That's lovely. That's great. But what about the medical services that people have to go sometimes to Bristol, sometimes to Taunton, and that's where it falls down.
Yeah.
And so we are looking at setting up that sort of scheme for people. But the problem is, you've got a limited number of volunteers who can work during the day. They're all of a certain age.
Yeah.
And what might happen is that if you don't build in sustainability and constantly be recruiting, that group of people go.
Yeah.
And you lose your volunteers. And it's down responsibility, giving back into the community. Yeah. It's about that personal. And I have to say COVID will impact, because that's a vulnerable group of people.
Yeah.
So, they're less likely to say, well, yes, that's all right, I'll take them into hospital, because actually some of the hospitals have had COVID in there, and, you start to worry. So I think that type of thing is really hard. But there is a place for the community stepping forward, saying, yes, we will help. I mean, the community cafes we've set up is run totally by volunteers. We got funding from, we got a couple of grants. But then also Barrow Village Hall turned around and said, you're doing such a wonderful job, we're not going to charge you rent.
We wish we had that.
There are community people out there who will stand up and be counted.
Which is
it's
fantastic.
It's just recruiting, isn't it?
But you see, we have the same challenge that, we are very fortunate that we have a cohort of people who help.
Yeah.
But has the community come forward to do a lot? I could probably count on one hand how many people in the community have ever, in the whole life of the charity, come forward and helped. And I mean, I'm being generous.
I think there's a lack of understanding. Mm-hmm. And I think also with the rehabilitation, there has been a certain amount of fear among some people.
Ignorance.
But I think, it's understanding how the community's perceptions are. And actually, that's one of the things I'd really like us to work together on, is to change that perception.
I think what's really sad, I remember when I opened the rehab, is it 18, 19 years ago? I can't even remember how long ago it was. And there was a petition against the rehab being opened. And it was like they had 250 signatures against the rehab being open, because they believed that there were going to be drug takers, there were going to be needles everywhere, and just through naivety, really, people just don't understand what a rehab means and represents. And I know that the community can honestly say that actually no, that's not the case.
Of course not.
But also the benefits of the rehab is that what it's brought to the community, and what it's brought to the community. I think we do something like 185 voluntary hours in the community, and we don't see anybody in Burnham-On-Sea in the rehab or from Highbridge.
No.
Indeed, we see nobody from Somerset. I think we have had 2 referrals in the last 5 years from Somerset, sadly. And all of those people are strangers giving back to a community that they know nothing about. And I think that's the bit that actually you're willing to take people's free time, you're willing to see them as volunteers, you're willing for them to help in your charity shop or help do this or make a coffee or go to the church or do the food bank, or the list goes on and on
I
and
know,
on.
I've met
Yeah,
people around us.
but then they turn around and go, oh, I'm scared. I just find that ridiculous.
But
Absolutely ridiculous.
the work you're doing with all your groups working within the community as volunteers is having an impact, and I think we need to highlight that because they are giving to our community.
Yeah, completely. But we're not the only organisation that give to people. There's lots of other organisations. There's lots of people. Like we've got kind of almost gone full circle, haven't we, about recognition and how you give people recognition, because some people get an awful lot of recognition and some people get
Nothing.
bugger all.
Yeah.
Absolutely nothing. And they're quietly doing, I suppose it's a bit like the charity, they're quietly doing what they're doing, but actually is there a point where, as a mayor, I'm handing this one back to you.
Yeah, no, that's fine.
As a mayor, is there a point of saying, let's just have a recognition day of all the people that do?
Well, we've got civic awards, of course, and I'm reviewing that now. I'm learning a lot about that. And obviously,
because I think that comes down to who you know and what you, and whether you're friends with the person that's in the.
Well, I hope it's not that, because what I really, really want to be sure of is that we do open out our award system so that we recognise not just a few, but the many people, particularly during COVID, who've done things, but also the people, the quiet groups that are quietly getting on with it. Those are the ones, and that's why I've been trying to get out into the community and invite myself places.
To find out about them.
Exactly. I'm trying to build the jigsaw puzzle. And I'm still putting pieces in place. And also another aspect of that is that I can then be a conduit to put people together so that if something's happening over here that's really good, somebody's starting out over here, I can say, why don't you go and see? So I feel that's a really important role for me as mayor, to be aware of all these things that are going on and start to build that network. The spider's web, you see.
There was a couple, I never forget this, it was really funny. When we first started doing the coffee and chats in Burnham, there was a couple, and I know the lady, she's called Sue. I can't remember her partner's name, I apologise for that, but her and her husband, partner, whatever, just turned up at the first lot of coffee chat. She knows me through somebody else, and we were desperate for help because it was kind of me and a couple of other people, and it was tough, you know, and I didn't really want to be doing it after full-time working for the charity in the evenings as well, then blah 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 blah. Anyway, this lady turned up with her partner and just got behind a counter and helped out, and they have been people that have been a constant throughout the time that the coffee and chats have gone on. They're very quiet, they're very unassuming. She might make pots of jam and just bring it along, or bring some this, that, and he might help out with something else, and it's like, wow, thank you very much. Do you know what I'm saying? And it's really gratefully received, but they're the kind of people that I feel need that kind of recognition for what they've done. And it's such a, just to come in and just do it without even making a song and a dance about it.
Well, when I put out in local reach, when we were starting the community hubs and cafes, obviously we had a core of people, volunteers from the church, but it was very much about working within the community. We wanted everybody to know it was happening. And we had people just like that who said, yeah, I really want to help. Yes, and it's in my community, I want to be there. And so we've now got a good core of 40 volunteers.
Wow. Bloody hell.
That's really good.
Some are some are baking for us, so they provide the cakes. And others say, no, I'll be there, you know. And, you know, And that's what I want to say to people. We do have some wonderful people doing great jobs out there. Let's not be negative.
Yeah.
Let's be positive and say, this is really something to celebrate.
Yeah.
And with the youth aspect, what I want to do in the autumn, because there's so much negativity in the media about our youth. And I have great faith in our youth, and I think they're wonderful and do a lot of great things. I want to have a celebration of youth, and to actually have a day when all the groups in the area can come together and say, this is what we're doing, this is what we're about, and this, and I'm hoping to work with King Alfred's in that, but the other groups as well.
Sounds fantastic. Yeah.
And they do some fantastic. The kids do some brilliant. They've done a lot of fundraising. They did a lot of fundraising for the charity. They're very kind about what we do. They respect what. I mean, I've gone in there and done some bits and pieces at King Alfred's. We've got counsellors that help there all the time, but I've gone in there, and when they've needed an emergency or whatever, I've gone in there and helped them out. And it's like, and you hear, they come and talk to you. I just sit in a room and they come and talk to me, and they tell me what's going on, and they're very open about how they feel about not just the community, but the community within the school, or what's going on at home for mum and dad, and how mum and dad are coping, or all of that kind of stuff. And I think it's they're having that voice and being able to recognise that they have a voice. I think it's just such a wonderful thing.
It's not just having a voice, it's knowing you're listened to.
Yeah. Oh, completely, yeah. I suppose I do that automatically.
It's knowing somebody actually listens and recognises what you're saying, because I always used to talk to my children at school and saying, yes, you can listen, but are you hearing it? Is it staying? Are you responding to that, what you're hearing? Or are you just letting it go in one ear and out the other?
Yeah.
And a lot of people do that.
Yeah.
Oh, I've listened.
Really? But it's like that generosity of you having like a free venue. We've had free venues so the counsellors could go and see people, like at the schools. The schools are really good like that. So we might not be seeing the children there. We might be seeing a parent there.
Yes.
The doctor's surgery in Cheddar let us use a room there as well. That, I know we're seeing their patients and stuff, but it's like they're giving us that recognition as a charity,
and
to
valuing
say
what you
and
do.
valuing what we do. And I think the coffee and chats, we've had up to 150, 200 people sat there, and certainly after COVID, because everybody had missed it. It was like,
it was lovely when I was there the other day. The atmosphere is lovely.
Yeah.
It's
And
really
we're hoping
good.
that gets established in Cheddar.
Yeah.
Do you know what I'm saying? But there's always that, when you've got to find rent, and we're not the only organisation that has to find rent, but you have to find rent all the time. It does impact on small little organisations. Well, you know yourself.
Yes, absolutely. I mean, we did go for grant funding, and that's really helped us set up. But we wanted to be self-sustaining.
Yeah.
At the end of the day, that's what we wanted, because you don't want to be constantly asking for money.
Of course you don't.
But with everybody giving time and cakes, all you're meeting is rent. It's
That's
the rent
it.
that is the
Same as
major.
us. We're the same. That's all we pay is the rent.
Yeah.
Fantastic.
Actually, that's not true, because I think myself and Dave pay for coffee and sugar
Quite possibly, yes.
and milk and various other bits. But not that I don't mind that. I actually don't mind. I like the thought of buying a cup of coffee for the community. I love that thought.
Yes, then you're giving back as well.
Yeah,
But you see,
completely.
we don't charge anything at
No.
our cafes. It's donation.
Yes, same as us.
But do you know, it's fascinating. I think we gain more.
You get more. Of course you do. That's
because
exactly what we
people,
do.
particularly specific people, have actually said, we did a celebration service in church the other day about the cafes and how proud we were of what we'd done. And I went round each of the cafes and talked to people and said, look, I know you may not want to come to church, but I'd like to share what you feel about what this community is doing for you. And one guy just turned to me, he said, Lesley, it's life-saving.
Oh.
He said, this is the highlight of my day.
Oh.
And
How
he
often do you run?
Well, every week, every Tuesday afternoon in Barrow and every Thursday afternoon in Breen. And he goes to both. And we've now gained a group of guys
A cohort, yeah.
that are going everywhere.
Do you have
That's really
flyers
nice.
or not? Because
Sorry?
have you got flyers that you advertise. Because if you gave us the flyers, we can then take them to the monthly one that we do in Burnham.
Yeah.
And we could also take them to the Cheddar one as well. So
Brilliant.
I know it's out of your area as such, but it's also about bringing communities together. It's not just...
absolutely.
Yeah, it's creating that community.
And I'm actually
cohesion.
talking to Liz Bennett, the wife of the minister at the Methodist Church, because she's wanting to do something similar.
Yeah.
So that's very central.
Yeah.
So, you know, we're talking together. But you see, at our cafes, we have Citizens Advice come
Yeah.
once a month.
Yeah.
We have the Village Agent come once
Yeah.
a month. Digital Champions from Sedgemoor, Melissa, she comes once
Yeah.
a month as well. Because, as we know, computer skills are not very strong
Yeah.
in a certain age group. And everything... You know, you have to fill in a form. It's online, isn't it?
It is now, yeah.
And if you haven't got Citizens Advice close to hand,
But we have invited all of those along to us, and they haven't come. So what I don't want to get into that, but there's a sense where why is it that some organisations respond to some? You can see where people's frustrations sit,
yes.
can't you? Because you know, why will they come along to your coffee and chat, but they don't come along to our coffee and chat? Well, yours is on a Tuesday and a Thursday probably, but we do ours on a Saturday, so it allows all the communities to, all the people in the community that may not have to go to work.
Yeah.
So it opens it a bit wider. But why won't they come to us? We have one lady that comes, don't we, from the health. I can't remember her name, but she comes and she does a fantastic job, and we're very grateful that she comes. But none of those other organisations will come.
I think they're
It's really sad.
like everybody, they're thinly spread. Funding.
They've got funding for it, I know
and
that.
they've got. We're having a change of staff quite frequently. The people who come change. We started off really well with the same people, and now we're having different. But they're able to make appointments for people to come to the cafe. You see,
Oh, that's a good idea.
Yeah.
so they draw them that way.
Yeah.
And what I've been saying to them is, coming to us, you're reaching people close to their home, and if they haven't got a computer, they'll come and see you face to face there. And it's that outreach that's so important.
So, can I ask that if we give you some leaflets for our coffee and
Absolutely.
chats, and then you give us some for yours, but can you also speak to these people that come to yours and ask them to make contact with us, please?
Yeah.
Because we've tried.
So the village agent hasn't either. That's
But the village
interesting, 'cause
agent
they're
makes
more like-
referrals to the charity. They all make referrals to the charity for counselling, but none of them support
the actual
coming to the actual coffee and chats,
Okay.
which are really integral part of what we do.
Yeah.
When you think there's 150 people or more there sometimes.
Well, Melissa at Sedgemoor might be really interested because she's trying to build up the digital champions, and what she does is, what she did with us is she trained 6 of us to be digital champions. But she still comes.
What the hell does it mean? Just
Well,
tell me.
we've been donated various computers so people can come to us. Now, it's nothing about technology. There's no point coming to us about technology, but for any computer skills, so that if we've got a lady who came along and said, my husband has dementia on an evening, he's asleep, I need something to be doing. I've got this iPad and I don't know what to do with it. My family have bought this for me and I don't know what. So one of our members has been quietly just meeting on a regular basis and helping, giving access and writing down simple instructions
Oh, that's really nice.
to get your email, to get your, and because it's one-to-one and it's quiet and there's not lots of people around, you can just chat quietly and give that support, and that has been used. Not so much at Breen, more at Berrow. And somebody else actually brings in all her stuff and puts it down and says, right.
Help me out here.
So we do what we can, but Melissa picks up the bits we can't.
Yeah, perfect.
Because, I mean, I watched I, Daniel Blake, and it upset me so much. Did you ever see that film? Oh, broke my heart. Because it was a very strong social message.
I did. It's about the guy that was that became sick. He had a physical challenge. If you see it, he got sick. I cried all the way through it.
I did too.
So, and because he couldn't do digital.
He ends up dying, but he couldn't get access to. They kept saying, "Go online and do." I haven't got a computer.
Yeah.
Well, go to the library. Now, people in the library didn't have time for him, but other people, young people that actually were on the group, were trying to help.
Right.
But he's timed out because he's not quick enough on his skills.
Oh, I see, to do it. Oh, goodness.
It was horrendous.
It was
He ended up
Sounds more like a documentary than a film.
It was a bit of both.
Yeah, a bit of both.
I can't remember the name of the director, but he's well known for his really social comment, and that immediately said to me, right, at my cafes, I'm going to make sure we have digital support.
Oh, fantastic!
And so if people haven't got a computer, they can come to us, use our computers, and we'll sit with them and do whatever they need to do.
So because we use a financial person a financial group that come in every month to the rehab.
Oh, brilliant.
But they don't come to the charity, which is a bit sad really, because they could actually. I'll get Victoria on that. But I do think it's an absolute gap in the community where people do not. I mean, give me an iPad. I don't think I'd know how to work it. Please don't tell them that at work.
We've got tablets at the council.
All of my team have iPads, and all of the charity people have iPads. But I don't think I've ever used an iPad.
Not?
No, because I use my laptop.
Yeah.
My laptop is like connected to me like.
And
third leg.
All our councillors have a tablet, and it's totally different.
Yeah.
We're using Outlook, and I'm thinking,
and
I'm relatively confident because I've always used Gmail, as you do, and Google, and so it's a huge learning curve. But when you've never had to use a computer in your life before, to be faced with a machine,
it's overwhelming.
It's frightening.
Yeah.
And the frightened of pressing a button and losing everything, which we've all done, I'm sure, in the past. So it's trying to build confidence and say to people, it's all right.
I always say everybody needs a mic. So I have Mike at my disposal, which I'm very grateful for. But also, I've got a younger son. I've got my family help me. But if you don't have a family, it comes back to that isolation again, isn't it? And we're kind of in that round circle again. We've come back to isolation. How do people feel? But also your position as a mayor, I wonder if at times you feel quite isolated being sat in the middle of it all.
Well, it's really interesting because as mayor, and as you know, I'm a practicing Christian, so I attend St Mary's Church at Barrow, and I asked if my minister could be the chaplain to the town council, and he is my spiritual support. So I will be using and talking through things to put things in perspective. Because yes, there are times when you think, what have I done? And I think everybody faces that. But he's my support. And we also are building a team together, so we support each other. But yes, it is. It's a huge responsibility. And I want to make sure that, I've got a year. I might have 2 years, but I've definitely got 1 year. And that's going to pass in...
Oh gosh, yeah.
It'll go very quickly, and I want to be sure I've done what I want to do in that time.
But that then replicates what you're saying about earlier, about the fact that actually things change so quickly that you haven't had time to do the things that you want to do. So, so it's like, I wonder if the town council could think about actually having the mayor for 3 or 4 years rather than just being 1 year and then having to renew.
I think there's always this thing, well, they might want to get rid of you very quickly because you're a pain. But
I'm saying
let's hope not. Yeah.
But I myself have to have support. I have support every month. So I sit down with somebody every month for a minimum of an hour and a half.
Yes.
And then obviously we've got a team that we all support each other. But I do that because otherwise I wouldn't cope with the burden of what you're carrying.
Absolutely. I'm very lucky. I've got a very strong family. My son and my daughter are very good, and my siblings as well, and we Zoom once a week. But there are things that you can't talk about to them.
Yeah, it's confidential.
So Jonathan is a great support in that way. So good. I'm very lucky.
I'm glad to hear it.
Yeah, I think we all need it.
Yeah, I think I completely agree.
Yeah, so I'm conscious of time.
Yeah, we've got 2 minutes to go.
We've got 2 minutes to go.
Is there anything you'd like to ask us?
No, I don't think so, because actually I think you're doing such a wonderful job. All I would like to say is, do use my role. I'm here to help and support in any way I possibly can. And let's get the word out there and value everything you're doing in the community.
What we would like to ask you is, if you know anybody that would like to appear on our podcast,
yes,
anybody, we're absolutely open to anybody at all. So
definitely.
If you've got a list of people that you feel would be willing and able,
I'll put it out there.
Thank you.
I'll put it out there. That would be really good. Yes, I think as you say, it's about raising awareness and getting people to talk. And I think a lot of mental health issues is about talking and listening.
For sure. Thank you very much for coming.
Yes, thank you for coming along.
No, I've thoroughly enjoyed it.
We hope to have you back perhaps this time next year.
Oh,
We
yes,
can
I
do
can
a
tell
bit
you
of
all
a
the
review.
wonderful things I've done.
That's it. Brilliant. Thanks very much.
Thanks very much.
It's a pleasure.